Hi world, Beth Levine, chemotherapy infusion nurse. I'm here to give you some tips about ACT. We're only going to be talking about the AC today. I'll do the T on the next video because they're two different things. But you're going to be getting the AC, and you're probably a nervous wreck because it's scary. Going the first time, they're going to access your port. So if you're afraid of that, make sure you get Emla cream or lidocaine cream. It is a prescription. It runs about $8 a tube, and you squeeze it on before you go in. Put like a piece of plastic over it, and you won't feel a thing. You won't feel the needle going in. You probably won't even use it after the first time, but a lot of people are afraid, so they use it. Hydrate, hydrate, hydrate. I can't express enough how to hydrate. You need to hydrate. Coconut water, Gatorade, whatever you need to do to hydrate the day before and the day after. It's also going to help your bowels move. Sometimes the prescriptions that you get for the anti-nausea medications, Zofran or ondansetron and compazine, prochlorperazine, sometimes they can cause constipation, so you might want to chase it with a little bit of prune juice. This is the day after your treatment. Make sure you have prune juice on hand because it has sorbitol. It brings water into the bowel and helps with peristalsis. You can even try Smooth Move Tea, which has senna in it, which is a stimulant and helps the bowels move too. So you want to have those things on hand for the day after, not for the day of the treatment. The day of the treatment, you're going to go in, they're going to check your blood count, your CBC, your complete blood count. And they're going to look to see your white blood cells mostly, your neutrophils, and those are the fighting soldiers of your bloodstream, and they're going to make sure that it's okay, and then they're going to ask your support, and they're going to give you pre-meds for about 45 minutes. The adriamycin takes about 10 minutes. The nurse is going to check for blood return while she's administering it to make sure it's comfortable and it's working well. After that, she's going to give you Cytoxin. Cytoxin is usually given over a half hour, but sometimes it could irritate the mucous membranes and give you a little bit of a headache. So definitely, if that's bothering you, just ask the infusion nurse, to slow down the rate, maybe give it over 45 minutes, and definitely opt for the additional hydration. If there's hydration on the pole, finish it up. You might as well. It can't hurt you. It's only going to help you with managing the side effects. You're probably going to be getting Neulasta either the day that you get your treatment. They put on a patch and it actually gives you the medication the next day, or you may go in the next day and just get an injection, either one day or maybe 4 days, depending on which one they're using. And this could cause your bones to work a little bit on overtime, the marrow where blood cells are created, and this could cause a little bit of aches and pains. So they do recommend loratadine or Claritin. Make sure you discuss it with your doctor or your nurse practitioner. Make sure you're taking it correctly and they're okay with you taking it. Let's see what else. You're going to lose your hair. There's no doubt about it. Adriamycin, you're definitely going to lose your hair first or second treatment. So you're probably going to want to get a wig beforehand. You can get a prescription for a cephalic prosthesis. So hopefully it will be covered by your insurance. But if not, you should definitely want to get a wig before your hair falls out, so it's closest to the way your hair is now, and people around you, their reaction won't freak you out, because when you see the reaction in their faces, you could read their faces, and that's going to make you probably more uncomfortable than your own response to losing your hair. But it's you're going to lose just your hair on your head. You shouldn't really lose your eyebrows because it affects cells that are replicating quickly. So, your eyebrows would be down to here if obviously they grew at the same rate of your hair. While you're getting the adriamycin, while the nurse is pushing it, you want to keep your mouth cold. So bring in ice pops or get some ice chips. But while that is going in, you want to keep your mouth cold, and that helps with mouth sores. So you don't get mouth sores. It helps constrict some of the vessels in your mouth so blood flow is not 100%, and it hopefully will protect you from getting some mouth sores. I don't really see mouth sores nowadays that often, but it's something you should be doing with adriamycin. So you'll be there about an hour and a half tops, maybe 2 hours tops, and it should be okay. You're going to be okay. Get a theme song. Get something that gives you courage. You're going to feel much better after the first treatment. Everybody comes in scared to death, and then they leave. They're like, it wasn't as bad as I thought it was going to be. So prune juice, fluids, anti-nausea medications, get a wig, and bring somebody with you that's really supportive. Get a theme song. I've heard from a lot of different women. They have these great theme songs, and it's just keep it in your head. It kind of gives you a little bit of courage and a little bit of empowerment. I hope this helps. Please share with other people that you think may be going through this. I'm going to post the Taxol part of this, which will be 12 weeks after the 4 treatments of adriamycin. and I'll go through how we can deal with those side effects of that medication. You're going to be fine. You're going to be fine. You're going to be fine. And if you need anything, please email me at askthechemonursebeth@gmail.com. Okay? Good luck to you. I'm here if you need me, and wish you the best. Thank you. Bye.